Before the questions, I would just like to conclude the presentation. As a speech language pathologist, we start our assessment right from pre-linguistic skills. So the eye contact, more than the eye contact and response to name call, what we look at is something called communication intent. Is the baby connected to the environment? Is there an intent from within to communicate with the parents or whoever it is in the environment? For communication, definitely you doesn't need to have a verbal language. We can always use a lot of non-verbal signs, or even the eye gaze will help us to understand the child wants that thing, isn't it? So our evaluation starts from there, or our baseline evaluation, especially before starting therapy, we always prefer to start from the pre-linguistic skills, and then we will move on to the speech. In speech, definitely, it's for us, it's only with respect to the clarity of speech. So can we do a speech at that moment when the baby doesn't have a communication intent or the basic skills? Prerna? Definitely no. We don't go for speech evaluation, we go for a language evaluation. In language, we have two components. One is comprehension, that's your understanding ability, and the other one is expression. So when it comes to both of them, again, we have levels called semantics, syntax, pragmatics, and the morphology and phonology. And semantics is nothing but the nouns, basically any words or the nouns we consider under semantics. Every child should have the meaning between the word and the relation to the object. As Pooja has quoted, many parents tells us, my child can count. How they count? They will be reciting the numbers, but if I put 10 chocolates in front of them and ask them to give me 2 chocolates, they might not be. So the concept might not be there. They'll put on the switches of fan and light. They might be looking at it also, few kids. But then on instruction, if you say where is fan, they might even not be able to look at it. And then comes your pointing, the near pointing, far pointing, proximal pointing, your declarative pointing and stuff. Right, so from the semantic level, it starts with the words, it goes till the sentences. And once a child learns it, if the child comes at that moment, you need to do the syntactic assessment. Syntax is nothing but something to deal with the grammar of the sentence. And then comes your phonology and the morphology, which is the sound system of your brain. Is the child having a discrimination between the sounds? Then we will see, is he pronouncing it properly? And then comes our pragmatics. Pragmatics is the social use of language. Pooja went in depth about it, and even our Gish has talked a lot about the pragmatic assessments. And then comes our suprasegmentals of speech. That's your stress patterns. Where are you giving the pause? Where are you acoustically highlighting the word? Which one is important in the sentence? So all these things together, clubbed together, covers by the speech pathologist. And then in audiology, we work about the auditory processing disorders, which Dr. Dirish has rightly mentioned. And then when it comes to the feeding part, most of the children might have issues in eating food. That's when we evaluate even for the praxis. When we do the praxis evaluation, I hope you all know there are different types of praxis. So we start from non-verbal praxis or the oral praxis, and we go till the apraxia of speech in children. So definitely there is a huge, and all are interlinked, and where you start your assessment definitely depends on the baseline of the child. If the child could speak in words, I doesn't have to probably not check about the syntax of the child, because that's unmeaningful or non-meaningful at that level. So always based on the child, and definitely speech people, as speech pathologists, we generally concentrate on all these things rather than diagnosing the child into the autism. And these days, autism is definitely a team approach. We all know the complexity of it, and without team, nothing can be done. So I hope you all agree about the roles of our developmental pediatrician, our psychiatrist, our pediatricians, our physicians, and all our therapy people. Right? We all need to be united and work together for the betterment of the child, rather than working in bits and pieces. We might have a lot of cross terminology. We all might be concentrating probably on an ultimate goal would be the same, but we might be using different words as per our departments. I hope you all agree with it.